My name is Dr. Talia Marcagiani. I'm a naturopathic doctor. I have a special focus in mental health and hormones. And today I'm going to talk to you about how hormone imbalances could be the hidden cause of depression and anxiety symptoms. So we know that 10 to 20% of people are affected by depression and anxiety in North America. We know that mental health and emotional wellness are the pillars of happiness and well-being in our society. When it comes to conventional treatment, we only have a narrow range of options available to us. So if you go to a regular doctor, you might get put on a selective serotonin reuptake inhibitor, an SSRI medication like Prozac or Cipralex for your anxiety and depression. And this is based on the theory that people who suffer from depression and anxiety have a brain imbalance of the happy hormone, serotonin, in their brain, and that these drugs correct this imbalance. There's nothing you can do about it, you're born this way, and you're going to be sick for the rest of your life. But when we look at the research, we find that these drugs are not always better than placebo. In fact, they're just slightly better than placebo, and in some studies they're not better at all. They also come with a lot of side effects like fatigue, weight gain, sexual dysfunction, changes in motivation, further mood changes. And when we look at studies over the long term, we find that people that are medicated don't do better than people who were never medicated at all. So looking at the research, we know there's something else that must be going on. And with the people I work with, I find that depression is a symptom. It's not actually a disease. It's not something you're born with. It's a symptom of something going on underneath the surface. And a lot of the time, these underlying conditions are hormonal imbalances. So we know this because we look at the symptoms of depression. You're fatigued, you feel sad, you don't have motivation, you might be suffering from low self-esteem, you might be experiencing sexual dysfunction, you might have changes in weight, changes in appetite, and sleep disturbance. When we look at those symptoms, we can also look at symptoms of cortisol imbalance, the stress hormone. So we have something called adrenal fatigue, where you have the same symptoms. You feel fatigued, you notice changes in your weight, like weight gain, you don't feel motivated, there's changes in self-esteem, it's hard to stay positive, and there's changes in the sleep-wake cycle. So you might be waking up at 4 a.m., you might feel really tired and need a sugary treat at 3 p.m., and a lot of people notice energy crashes at 10 a.m. So this is a really common thing that we see. People waking up at that 2 a.m. to 4 a.m. window in the middle of the night and can't fall back to sleep. But when we look at testosterone deficiency, and a lot of women can experience this, especially after going through menopause, you find the same symptom. You might notice that you have a harder time putting on muscle mass. You go to the gym and you're still feeling flabby and you're not feeling like you're toning up as easily as you used to. You might notice wrinkles. And we also have issues like thyroid conditions, which are very common right now, especially autoimmune thyroid conditions like Hashimoto's thyroiditis, where the immune system attacks the thyroid gland. And again, the symptoms are fatigue, weight gain, brain fog, changes in appetite, changes in sleep, a whole host of symptoms. So we know that these hormonal imbalances can be causing depression, but when patients who are suffering from these conditions go to their doctor, they might be diagnosed with depression and put on an antidepressant, which is just covering up the symptoms while the disease process continues. So I see this a lot in my practice, and I'm really passionate about helping people uncover the hidden causes of depression so that they can feel better, well, and be more effective in their lives. And so in naturopathic medicine, we do this in a few ways. So when I first start working with somebody, I take a thorough history, a 90-minute history, where I go through your lifestyle, who you are, what your health story is, what your appetite is like, what your diet is like, what your sleep is like, how often you move, when, where. I talk about, if you're a woman, your menstrual history and sexual history, past medical history. So we go through everything about your lifestyle, and we spend 90 minutes doing that, getting to know each other. I might write some labs, so we look at levels of vitamins and hormones in your blood to see how your body's functioning. Do you have the building blocks you need for your brain to work and for your mood to be as best as it can be? And then we look at influencing the factors that contribute to wellness and mental health and proper hormone balance through lifestyle changes, through herbs, nutrition, through acupuncture, through managing stress, which is a big one because we know that stress is the underlying cause of a lot of conditions, especially hormonal conditions and mental health conditions, and managing stress is really important right now in our society as we're faced with more and more emotional and mental stressors. So naturopathic medicine looks at the cause behind symptoms. That's the key. combination of symptoms, and we connect the dots and act like detectives to find out what's going on underneath. And we use the story that you tell, the story that your labs tell, the physical exam, and our knowledge of biochemistry and science and body processes and the latest research to find out what's going on that could be contributing to the mental health symptoms. I'll be talking again about more mental health conditions and how naturopathic medicine can help you with your health goals. If you want to reach me, my website is taliand.com, and I work at Bloor West Wellness Clinic